Healthcare workers across our area will roll up their sleeves to get their first dose of the COVID-19 vaccine today.
That includes Dr. Hawkinson of the University of Kansas Health System, who has been joining us live all throughout this pandemic to answer our questions and keep you informed. He does join us live this morning, just hours before his first dose. So, Dr. Hawkinson, we got to ask, you've been talking about the pandemic and the vaccine for months. Can you just describe your emotions right now and how you feel ahead of getting your first shot?
Yeah, I think it's great just to look back on where we started, where all of this started, from early December in Wuhan till what happened in the United States almost a year ago until now. I think more importantly, it shows that certainly science and technology and building upon all of the feats that we've accomplished up to now, because creating this vaccine and creating any therapeutics is really multiple steps from all the technology that has come before. I think it's important. I'm ready for mine. I do feel safe in the hospital and in public when I'm wearing my mask and wearing my goggles and eye protection in the hospital and PPE. I think it's more about really those other people and employees that are working on the COVID units every day in our front lines, in our emergency departments. And I'm just one person getting a vaccine. I think it's more important to give that message out and keep spreading that message that it is safe. I think that is much more, that's my mission to do, rather than just one vaccine or one shot in the arm. It's more about that message and changing the minds and the hearts of those vaccine hesitant people and really getting everybody on board to do this so that we can get as many people vaccinated as possible.
Doc, I've got to ask you, at any point or at some point back in, say, March, April, even May or June, if I had told you you're going to be getting your vaccine for COVID-19 before the end of 2020, would you have believed me back at that point?
No, I definitely would be very skeptical at that point. Just understanding, we've had other viruses that don't cause as much harm to as many people and don't impact the world as they do, such as CMV or RSV. And in HIV, we know the major impact of HIV. We still don't have a vaccine for that. That's been 40 years. RSV, it's been decades upon decades. So I think from mentioning that to me, back in March or April, I definitely would have been very skeptical of being able to do that now, right before 2021 is set to begin.
Sure. Now, every morning you do the daily briefing with KU Health. We cover it here on our 41 Action News Facebook page. We share it every morning. And you talked about COVID case numbers being down yesterday morning. You start every morning with that update of where the numbers are. We were talking about this morning, how much of a, for lack of a better word, shock is that to you every morning? How much preparedness do you have when you go into work on a morning, Monday morning, Tuesday morning? Do you know what the numbers are going to be as you head in over a weekend? What's the amount of preparedness you have from day to day, what the numbers are doing?
Yeah, we actually have it twice a day where there's a roll call or a census count of all of our active and recovering and our total COVID patients. So it's not surprising. I would like to say that I was certainly surprised and really more cautious when we were up to 102 or 104 active acute infections in the hospital, and of course taking up a lot of our ICUs. We know that the infection dynamics in any one community is different than another. I think we have to be so blessed right now with what we're at compared to what LA County is right now, compared to what Houston has been, or Detroit or Chicago or New York has been. I think it's a combination of, again, continuing to get out the message, people making those right decisions, and hopefully protecting everybody, protecting the mass numbers of infections. Even though we have seen a lot of infections recently, again, in a hospital capacity-wide sense, we are not in those situations that LA County finds itself in right now.
Doc, quickly, are you doing the shot live at 8 a.m. this morning, or are you going to do it before the call?
It will be live, yeah.
Live during the 8 a.m. briefing this morning. You can watch that on the 41 Action News Facebook page. Dr. Hawkinson, thank you as always for joining us. We appreciate you being here.
Thanks, Doctor.